Hey there, thank you for joining me. Hi, I'm Brian Leroy Jones, Associate Marriage and Family Therapist. And you may not know this about me, but off and on since 2004, I've been showing patients, just like you, how to experience more happiness, self-worth, and just feel better overall about yourself and your life. I've had patients from pre-verbal to their 70s. I've had teens, faith-based, those who were addicted, people experiencing anxiety, depression, folks dealing with trauma, as well as couples and families. And if you don't know, I've created a series of videos just like this one to help you find the right therapist for you. So make sure to watch the entire series before contacting me, because I'm going to answer a lot of the questions you're going to have for me in this video series. You know, you would think a mental health professional like a therapist would know what mental health actually is and how to define the mind. And wouldn't you agree that if you want to improve your mental health, a therapist you're going to work with ought to know what mental health actually is so they can help you achieve that. And if the mind is somehow involved in experiencing mental health, shouldn't a competent therapist know what the mind actually is? I'm curious, how would you define the mind? Perhaps you define it as a function of the brain. But if that's true, wouldn't we be talking about brain health instead of mental health? I mean, we know there's a separate, tangible structure in this thing called the skull in our bodies that we call the brain. I mean, you can see it in a scan, it can be touched. Heck, you can even buy a model of the brain on Amazon. But what about the mind? It can't be touched, you can't see it, but can it be sensed? Simply put, the mind is a regulatory process. But what does it regulate? Well, it regulates the synergistic relationship between the embodied brain, the brain and the body, and relationships. And by regulate, I mean the mind attempts to bring balance and coordination between your embodied brain and relationships. And you can see the signs when the mind isn't doing this well because it looks like chaos and or rigidity. And these are the things we label like anxiety, depression, relationship conflict, and so on. Thus, the mind is so much more than just what your brain and the skull does. And the better your mind is able to optimize the balance and coordination of your embodied brain and relationships, we can say the healthier your mind is. Which leads into how I define mental health. Not a lack of symptoms or disorders like depression, trauma, addiction, for example. And mental health is not just achieved by reducing symptoms of mental disorders. It's not just feeling less depressed or less anxious or having less relationship conflict. No, I mean, who wants to be less depressed? I don't want to be less depressed. I don't want to be depressed. Instead, mental health is optimal well-being. You could also say optimal harmony within your embodied brain and between you and others in relationship. And what mental health looks like within you, within your embodied brain, would be, for an example, an ease of living, a sense of peacefulness and contentment, an attitude of openness and objectivity. It would be the ability to observe without overly identifying with a thought, feeling, or impulse that you have. It would be, for example, the ability to observe an interaction you're having with someone you're in a relationship without taking on their mood or overly personalizing their behavior or what they say to you. And relational signs of mental health would be, for example, your ability to treat others with kindness, gentleness, empathy. It looks like in a relationship like compassionate communication, where you're seeking to understand another versus making assumptions about them or their behavior, nor are you trying to convince them that you're right about your belief. Not that that ever happens, of course. Mental health and relationships can be seen as honoring and respecting the differences between you versus rigidly fighting for agreement or like-mindedness. It looks like the ability to create repair where there's been conflict so that intimacy, connection, safety, and empathy are restored. Mental health can be seen through the acronym Dr. Dan Siegel came up with based on various peer-reviewed empirical research studies, and the acronym is FACES, F-A-C-E-S, F-A-C-E-S, and that stands for flexible, adaptive, coherent, which means it holds together well over time, energized, and stable. Not perfect, but reliable over time, stable. And what this means for you, this definition of the mind and mental health, why it is crucial for you to know and understand, is because you want to be positive, that the therapist you're working with knows what these are. Because if they don't, how can you reasonably expect them to help you improve your mental health? So you're not just, experiencing less anxiety or less depression or less conflict, whatever, but that so you begin to experience more happiness, more love, forgiveness, self-control, empowerment, and an ease of living. Thank you for your time, and I hope this has been helpful for you. When you're ready to experience more peace, joy, fulfillment in your life and relationships, call or text me at 925-261-6688. Again, 925-261-6688. Or you can email me directly at brianjonesamft@gmail.com. That's BRIANJONES. A for associate, M for marriage, F for family, T for therapist, @gmail.com. I look forward to speaking with you soon. Take care.